You're listening to Soundside. I'm Libby Denkman. In a few months, Washingtonians on Medicare could see additional hurdles when it comes to getting approved for their procedures and care. That's because the Trump administration is exploring the use of prior authorizations to assess whether medical services are necessary for patients. If they aren't, the procedures might not be covered. Prior authorization is a common practice in the industry, but not in Medicare. The U.S. Centers for Medicare and Medicaid Services says the tool will help weed out waste and fraud. And the agency says it will use AI to help make eligibility decisions. Washington State is one of 6 states that will pilot the program starting in January. Darius Tahir is a correspondent at KFF Health News who's following this change. Thank you very much for being here, Darius.
Thanks for having me, Libby.
So at the center of this pilot program is this idea of prior authorization. What is that?
Yeah, well, I assume many of your listeners are already know what it is and are, cursing in their cars. But for those who are lucky enough not to know, oftentimes if there's an expensive procedure, or if there's a procedure that's associated with a lot of fraud, the insurer will say, hang on a second, can you apply to us and get approval to get this service just to make sure that it's appropriate for you, that there aren't alternatives that might be better, and so on and so forth. So that's kind of the basic idea. Since then, what we've seen is that it's been applied to more and more procedures. The kind of requirements have gotten quite onerous. Doctors kind of complain about these private sector uses of prior authorization, that they feel like they're getting judged according to criteria they don't quite understand. And so it's become a real source of annoyance for doctors and for patients. Our sister organization, KFF, which does some polling, has found that nearly 3/4 of respondents think prior authorization is a major problem in the healthcare system. That's because it can delay care. It can mean you take ineffective care, and maybe you don't do care at all. And so that can be a major, public health problem, even as it might, reduce some healthcare costs for people.
Among the critics of prior authorization had been the administrator of the Centers for Medicare and Medicaid Services, Mehmet Oz. He was critical of prior authorization earlier this year. He said that the process was not something that this administration would tolerate. So how do you square that statement with this pilot program?
Yeah, that's what's puzzling a lot of people who kind of encounter this system. We interviewed a lot of doctors, hospital folks, people, in Congress, including Susan DelBene, who might represent some of your listeners.
Yeah, on the East Side, she does. Yeah,
that's right, exactly. So they're sort of like, okay, it's a little strange that we have this administration rolling out some voluntary efforts for private health insurers to kind of streamline or reduce their use of prior authorization, while at the same time kind of introducing new prior authorization. Now, the administration itself kind of says, look, this all kind of works together to protect patients and Medicare dollars. That's a quote from one of the spokespeople we talked to. But it is a little paradoxical for a lot of people who've kind of looked at this policy.
Tell us about the AI component of this. What is the AI supposed to be doing here? Do we know?
Yeah. So the people who have looked at the pilot program are a little unsure about what exactly can be done. So let's kind of put a note in that. But in the private sector, what kind of people use AI to do is, in theory, to look for, okay, is this a procedure that kind of fits with the facts, right? So is this a male, asking for, let's say, a breast cancer drug, right? That seems a little unlikely. Maybe we should take a look at that, right? So it's matching up oftentimes criteria together to see if they make sense. It's looking at whether or not people have submitted the right evidence, right? So for example, for some surgeries, insurers are going to want to see, CT scans or MRI scans of the affected area to make sure that it's appropriate for a surgery, right? So an AI thing can say, hey, there's no scan, or hey, the scan is of the wrong area in theory, right? And so it can kind of provide, in some ways, a sanity check, we'll say, for these kind of prior authorization things. That's the theory. Now, in practice, what a lot of doctors say is, look, these things are, just causing folks to go rapid fire through applications without really considering them. They're maybe not really looking at the data, or perhaps they're biased, in the data that they're trained on. And so those are kind of the general, complaints about these systems. The other issue folks have is kind of the way they're incentivized, right? So are the contractors who make these systems, are they paid, a slice of the amount of denials, right? So if I deny services worth, let's say, $100 billion, do I get, a $20 million cut? Just hypothetical numbers here, right? If that's the case, then I have an incentive to set up a system that is always on guard, always gonna, jump on everything that looks like possibly a problem. And I'm not going to worry too much if I mistakenly deny something. That's a concern people flagged about this, Medicare government pilot, that it appears that it's incentivized to deny things. That's something the administration denies, that they've set up to do. But that's what outside observers think, is that this looks like it's set up to be overly aggressive.
What about what the Trump administration is hoping to accomplish here? I mean, the program is called Wasteful and Inappropriate Service Reduction. So maybe that's baked into the title there. But what are the goals here? Why add this extra level of friction to Medicare?
Yeah, it's a good question. So, kind of just to take a step back, Medicare spending is a pretty huge proportion of the budget. The Trump administration has kind of consistently said that they are interested in reducing the deficit. Whether they've been successful is a story for another time. But if you are interested in reducing the deficit, then figuring out how to make Medicare operate more efficiently is something that probably looks appealing. In this case, this pilot program is starting out with a few specific conditions, right? So it's talking about skin and tissue substitutes, knee arthroscopies, right? These are stuff where, at least according to the insurers who have studied it, it looks like these are particularly fraudulent care, right? And so if we set up a really good AI system, we can catch some of this fraudulent care, or perhaps even prevent, unnecessary care that, might be harmful to people that they don't need. So that's kind of the rationale behind installing these systems.
Darius, Medicare has been much slower to adopt technology than private insurers. Do you see this as part of like a larger move by the federal government to try to modernize health coverage and catch up with the private sector?
Yeah, I mean, they have been very interested in using technology. That's been a theme, actually, I would say, of successive administrations since the Obama administration, which is when I've been covering it. People have always been interested in using more data, bringing telehealth, for example, bringing electronic medical records. So in that case, it's not really something that's super new. What is novel is this expansion of prior authorization. That is something that is a little unusual, and I think people are interested in seeing how it works.
And telehealth is one thing because that's something that patients, might be asking for convenience sake. I don't think any patient would ever want prior authorization to be worked into their healthcare, whether or not you want to see waste, fraud, and abuse addressed in other parts of the federal government. It's unlikely for most patients to be excited about this. This pilot will be rolling out in January, and Washingtonians, will be a part of this with these 5 other states. What do you think patients in these pilot program states could be in for? Like, will they see immediate changes, or what will you be watching for?
Yeah, I am interested to see how this actually works, right? There are a lot of systems, as I think I mentioned earlier in this interview, that doctors find very frustrating. And, there are a lot of these systems that have been part of class action lawsuits against, major health insurers, right? So it'll be interesting to see how effectively these work and how quickly people notice the change. So it will be something we're going to keep a close eye on.
What about potential challenges to this, lawsuits or questions from Congress, as you mentioned? Is there a chance that this gets pushed back or halted altogether?
There have been some efforts in Congress to kind of address this. We'll see with the shutdown whether or not that actually comes to fruition. The vehicle some folks are looking for is this kind of budgetary maneuver, but I'm not sure how that will end up intersecting with this ongoing shutdown that we're seeing in DC.
Darius Tahir is a correspondent at KFF Health News, absolutely one of the best outlets covering the health and wellness of Americans, when it comes to medical care, when it comes to policy. You guys are the best of the best, and I really appreciate all of your time today, Darius, explaining this pilot program to us, especially as Washington folks on Medicare are bracing for it coming in January. Thank you.
Thank you. Thanks again, and have a great afternoon.
Thanks for listening to Soundside. This show is only possible because listeners support us. If you're able to give right now, please check out the show notes for a link to donate. And don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m., Monday through Thursday, or anytime online at KUOW.org.